Great.
Alrighty, I think we can get going.
Sure.
Hi everybody. My name is Amanda Bittenbender, and I am part of the America's Choice team, and we are going to do a little product training and demo of the enrollment portion today for Kurt for Brokerage One, and just kind of take you through what it would look like for a back-end platform. How you would enroll a client, and then also, like I said, when one of my partners comes on, Steve, he will do a little product training and tell you a little bit more about America's Choice in whole. As I go through some of the demo today, I will also kind of throw little parts in about the plans that we offer, the products, who can enroll, some of the knockout questions, and so forth. So a little bit about America's Choice and what we offer is we have 13 plans that we offer. There are 3 annual max plans, and then there are 10 traditional major medical metal plans. And again, Steve will get into some of those. We have the major medical, and then there's 3 HSAs in there as well. So he will go over just how the plans operate, the different co-pays, deductibles, and what they cover. And I am going to show you how you sell a plan. So I'm going to go ahead and share my screen and walk through what an enrollment would look like and go from there. And if you guys have any questions along the way, please feel free to write them down or pop them in the chat. And we will take a little break in between the demo portion and the product training to get any of those questions answered for you. So when you are going to sell an America's Choice plan, you will get signed up, and there'll be an agent sign up link, and I'll show you where that's located. And once you get an agent sign up link and you go through signing up, you will have access to a back end platform that looks very similar to the one I'm showing here. And within your platform, you will have the ability to see the members. So these are going to be the individuals you were enrolled. It creates a CRM, and it holds all the members' information from the plan that they enroll in to when they enroll, to their information and so forth. So keeping all their information in one spot there. And if you bring in any agents, you can see any agents in your downline. You can also see when clients are going to be billed, as well as commission summaries as well. So this is going to be the backend platform for you to utilize and to track your clients and commissions. And when you get ready to enroll somebody, you're going to go ahead, and your enrollment website is going to be listed in your backend platform. And the last 6-digit numbers are going to be your 6-digit writing ID number. So that is unique to everybody. So you'll go ahead, and when you're ready to enroll someone, you will click on the enrollment button, and this page will be customized for you. So it will have, if you have a business name, your name as the agent, phone number, email, and so forth, up on the top of your enrollment page. And then also the agent sign up button, which I will come back to in a little bit. So again, you can take a peek at all the different plans that we offer, but from a $500 deductible to a high deductible $73.50. We have 3 HSAs, and then we have our annual max plans, $100, $250, and $500. So when you are getting ready to enroll a client, this is the site you're going to come to, and there are a couple different tabs across the middle of the page that you have access to, and you can go into and get more information on the plans. So underneath the information tab, it goes a little bit more in depth of the plan itself. So we see the deductible, we see out-of-pocket max. There also is a full brochure on every product that you can click on, and you can see fully all of the co-payments. You can see what is allowed in network, out of network, and so forth. So each plan has a brochure attached to it. There is also, this is super important, that we let you know as well, there is a provider search. So right now, the plans that we have listed work in the PHCS RBP provider network. So they are the uh, that's the network we're working with. And if you want to go ahead and search the provider, you'll click on the provider search and you'll be able to look up your clients, doctors, hospitals, anything that they are specifically looking for using that provider search. And it's really important that you do that. If someone is questioning, hey, I love my doctor, are they going to be in network? So trying to make sure that this is the right fit and the right plan for your client. And in doing so, using that provider search. Underneath pricing, all of our products, our traditional major medical and HSAs, are tiered. So there's 3 tiers for pricing, and it goes on age bands. So our products do not ask or increase rates for height, weight, or smoking, but our prices are based on age bands. So we have 3 different age bands. Those age bands are 18 to 44, 45 through 54, and then 55 through 62. So our plans allow for you to write on individuals all the way up until their 63rd birthday. Okay, so if they're under 63, they can enroll. If they are 62 and a half, that counts. 62 and 11 months, they can enroll all the way up until age 63. Now, let's say somebody enrolls on their 60th birthday. They keep this plan till 65, till Medicare age. Amanda, does the plan keep going? Yes. So we will cover them until their 65th birthday, but they do have to enroll before their 63rd. So with the different tiers and the different products, you can pop in an age. So let's say you're 35 and you want to view the cost per tier. If it's just an individual, we can see the individual price. We can see individual and spouse, individual and children, and then the family plans as well. So those are the different pricing. If you just want a quick reference, we do have different brochures that compare the prices across all the products. And then lastly, we have our states that we are available to sell in. We sell in all states except 6: California, Hawaii, New Hampshire, Oregon, Vermont, and Washington are the only states we do not sell in. We do, however, sell in New York. That's a big state I know a lot of people ask about. But other than that, each state we can enroll clients in. And when you are getting ready, you're going to move forward with your enrollment, you can press the purple enrollment button. And for example, let's say I'm going to write the 500 deductible plan on a client. Again, because they are age banded, we're going to go ahead and we're going to put in their birthday. So let's find somebody who's in the age band. So once I'm here and I've put in their date of birth, I'm going to go ahead, I'm going to click this update button in the bottom middle of the screen, and it's going to show the cost of the products there. One of the key components here is that you can choose the active date. So our active dates that you can have a product go effective are 75 days out. So that includes till November, December, and January 1st. And then with this, some key components here is we enroll till the 23rd of the current month for that individual to go first the following month. So for example, we will take enrollments for October, for the month of October. So October 23rd is our cutoff date for individuals to go effective and eligible November 1st. So they have to enroll by October 23rd to go effective November 1st unless they choose a later effective date. Once we hit that 23rd of the month, and it's the 24th, 25th. So if you were to enroll somebody this month on October 25th, it's going to push their effective date to December 1st. The November 1st is no longer going to be available. So just making sure that we understand the ability for a plan to go effective. It needs to be in and written by the 23rd of the month if they want to go effective a week later for that following month's coverage. So let's say I want to enroll my client for November 1st, and they're an employee only. If they were a different tier, you could choose a different tier here. And once you have the active date, the date of birth, and the tier coverage, again, you're going to come down to the middle of the screen here, and you're going to click Update. It's going to update, and then you'll hit this blue button, Continue. So once we continue on, you are ready to write the application. So pretty simple application here in the sense of they put in their demographics. So first name, last name, address, and phone number. We'll go a little bit further in a second here. So these plans are for individuals who are business owners, they're 1099s, okay? And the individual who you are writing the application on needs to be the business owner, okay? It can't be a spouse or anything like that. It needs to be whoever is the business owner. So they will be the primary member who you will put in here, okay? Again, go for their address, you'll put in their contact information. We're going to look for Social Security. We're going to look at their date of birth, and we're also looking for their gender at birth, not if they have a different gender than when they were born. From there are 11 questions that go to the individual who's applying and any of their dependents. So in order for you to be able to move forward and have this plan, you have to answer these questions, and the questions have to be answered honestly and truthfully to the best of their knowledge. And if they answer no to having any of these health conditions, then they can move forward and apply. So some of these questions, for example, in the last 5 years, do you have cancer, heart disease? Have you had a heart attack? Okay. Type 1 diabetics is a big one. We do not take type 1 diabetics, especially on insulin. If they are type 2 diabetic, we will take them. The other big question we get is if anyone who is looking for coverage is pregnant. We do not take a current pregnant individual. Either spouse is pregnant, we do not take currently pregnant, and we also don't cover, these plans also, Steve will touch on this, they don't cover dependent children's pregnancies either. That's something they're looking to change in future years, but they also don't cover that. And then they look at hospitalizations, COPD. So we can provide everyone. Kurt, you might have these 11 questions already, but really nice to run through the 11 questions beforehand with your client to see, is this a plan they would even fit into? Instead of coming to the enrollment page, starting the enrollment, let's find out beforehand if they fit into the plan. So when you're going through this, if them and their dependents answer no, you're going to continue, okay? No, they're not a type 1 diabetic. No, they don't have an upcoming surgery. If they answer yes to any of the questions, you do not need to submit the application. I do know there are some carriers who say you need to submit this application, even if it's going to be a decline. In our case, we do not require that. If they do answer yes to a question, go back to your toolbox and see if you can fit them into some sort of other plan. So once you're through the 11 questions, it comes down to payment section. At this time, we take 2 forms of payment. We take credit card and ACH. And with credit card, we take a Visa and MasterCard. And then we have the ACH bank draft. There is a 3% charge if they do use a credit card. So if you can push them into an ACH with that, larger monthly payment for the premium, please do so. Save them, a little bit money versus using a credit card, if they can. With this, I think I'm echoing. With this, everybody, the big thing here is payment is taken at time you enroll. There is not the ability to post-date an application. So please make it very, very clear to your client, hey, I'm enrolling you today, 10/19, October 19th. This payment is going to be taken October 19th for your November 1st effective date. Their following payment does not come out till November 20th. So the first month's premium is drafted and taken at time of application, and then their reoccurring payment comes out the 20th of the month that they go effective. Maybe it's a little bit different. Maybe you're writing the application today for a January 1st effective date. So payment would be taken today, and then their next premium does not come out until January 20th. So that is on the payment section. At this point, there is an authorization to do a checkbox, and then there is a signature section in which your client needs to sign. And you choose one or the other option. So you can either send it to their cell phone or you can send it to an email address. And even with your email address, if you send it to their Gmail and they have Gmail on their smartphone, okay, they can pull it up there as well. But the big piece here is you do one or the other. Please do not send it to both a cell phone and an address. We are actually having this updated as a disclosure to pick one or the other. And you press the send button and it will go out. What that does is if you send multiple or you keep pressing the send button time and time again, it will terminate the first link that they get. So super important, you only choose one or the other and you only send it out once. I will say from some of the experience we are hearing, and they're still working on it, but the cell phone link specifically based on the carrier some individuals have is showing us a little bit delayed time. So if you can push them to getting that signature in their email address, please do that. And once that signature goes out, the member's going to receive a link to click on. And there are actually quite a few places they need to sign. What's going to happen is it's going to lead them into the next part where they either initial or at the end need to sign. So for everyone, there are 11 spots where they either initial or the last one is a signature. And once they sign the link, there will be a submit button. They'll press submit, and then that link will come back to your page here where you were enrolling them, and it will turn green. There'll be a green disclosure here, and you'll come down and you'll hit the submit button. So that is how we get them into the platform through the application. And then what happens post-application? So post-application, there is going to be an email that comes out automatically, and it's going to be a receipt of confirmation email, and it's going to say, congratulations, welcome to America's Choice. Your payment was taken. And then what's going to happen is that individual is going to feed over to the TPA, who's going to process their enrollment. And that usually takes a couple days, so anywhere from 4 to 5 days. And once they are processed, the individuals are going to get a welcome email. And what that welcome email looks like is this. So let me show you. This goes directly to your client. Whoa, why are we so big? This goes directly to your client here. A little bit. Okay. And showed a little blurry here. I apologize. But this will go to your client. It will say, Dear Joe, welcome to America's Choice. Your effective date is this date, and this is the plan that you have chosen. Okay. And what they're going to do is they have access to a couple different items here. They're going to have access and need to activate their member portal. So I will show you what that looks like. They also will be told about when their physical ID cards will be mailed to them, and then who they can go to member services via the phone number or emailing member services if they have any questions regarding their plan. Okay, so I'll show you a few different things where they need to go. But when they get this email, they can go to the America's Choice portal, and in the America's Choice portal, they will need to activate. And why is it important that they go here? This is where all of the electronic versions of their medical ID cards, their welcome kit, all of that will be shown, and they will have that link to click on. It's going to house all of their information as a member, and they will need to either activate by demographics, so by Social Security or by date of birth, or they can activate by putting their email address in. Once they are in, they will just have a sign in button. And let me just quick pull up, you guys, the actual inside portion of, we call this the Personal Health Dashboard, the PHD, which is going to house all of that information here. So once inside their portal, it will look like this. Let me pull this back for you. This will be inside their personal health dashboard. And so within their dashboard, they have a few things that they can do, a few areas that they can go to. They have the ability to look at if they want to put medical information about physician reports or a health assessment report. They can put all of their health information, medical records in one. If they'd like to take any assessments, they have access to taking assessments, improving their wellness overall. There is a library of different videos they can watch. There's a health tracker if they feel like they would like to connect a Fitbit, a Garmin, track their health. But the most important tab that we really like to point out to everybody is their benefits tool tab. So underneath this tab is where they are going to go to see their electronic version of their medical ID card. And within the portal here, when they enroll and then they feed over, they'll have access to that member ID card about 7 days after they enroll. And most of the time it's before their physical copies come in the mail. And that gives them the ability, maybe they need to go and update it at their doctor's office. Maybe they need to update it wherever they go, they have the ability to send that in ahead of time. They also can see information on their plan or claims. There's also a little fact and question section. And then they also will have their telemedicine within their portal. If they need EAP, which is an employee assistance program for counseling, they have the ability to have that. And then they also have wellness coaching with registered nurses within the plan as well too. So this is one of the more important sections or tabs, I guess you could say, that would give this individual the ability to view all of their medical information. This is also accessible to them in an app. So if they would like to take it on the go or always have a copy of their electronic version of their medical ID card with them, you know, they forgot their wallet at home or something, they would have, in case of emergency, at least the electronic version. So each of your clients will have access to this. Okay, they each have their own personal health dashboard that they will be coming into for themselves. And so the last portion, we'll kind of do a recap, and then I'll show you the agent sign up link. So if we recap, you come into your enrollment site, you choose the plan the individual would like to enroll in. You click on your purple enrollment button. It takes you to, we already have one in our cart, but it takes you to the section. You walk through that enrollment with that individual. They're going to get a receipt of confirmation. A few days later, they're going to get that welcome email and the access to their personal health dashboard, and then their physical copies of their medical ID cards are going to come in the mail. And so that's going to come in the mail as well as a welcome kit. So within the welcome kit is going to be information more about America's Choice in general, what we do, again, their PhD account. It's going to show them how to get into it, more about it, it's about pre-authorization, about case management, and so forth. So they will get their physical ID card as well as a welcome kit, and that welcome kit will also be in their PhD account.
Hey, Amanda, can I?
Yes.
I have to leave, I'm sorry, but I had one question. Is the effective dates always the first of the following month? In other words, if we write something on November 1st, can we get an effective date on November 10th?
No, it is always going to be the first of the month, correct?
Okay,
And
up to
so,
the 23rd of each month. Okay.
yep, so always the
Thank,
first. Yep.
I just wanted that clarification. Thank you.
Yes, yes, of course. And so if we're back here, so when you're ready to sign up, there you'll have an agent sign up link, and we will make sure you have the password. The password for everybody is USA. And once you are in to sign up, you will put your company name or your full name here. You will enter in your demographics and your address, as well as more phone number and so forth. Anything with a red asterisk is required here. So you will also pick a username and a password to get into your management site. So that's kind of nice. You can pick your own here. And then you'll have to either put in, if you have a tax ID number for your business or social security, your NPN number for your license, and then also uploading your license. So you can either do your license here, or once you are in the uh, back end portion, there's the ability to add your license there as well. The key component here when adding your license is, in order for these products to show up on your selling site, you do have to enter a license. So anywhere that you are going to sell this product in any state, you do have to either enter that resident or non-resident license, and it will give you access. And then you'll sign and you'll submit your information. So then what happens is you're going to get a confirmation email with your login information to your management site, your enrollment link as an agent, and there will be a disclaimer. It takes about 2 to 3 days for your site to go active. And once your site is active, you will receive an additional email that says, congratulations, your agent site is active. Go ahead and feel free to log in. If you log in before that email comes to you, you're not going to be able to log in. So key things here is adding your licenses and then waiting for that email to come that you can log into your site. So that is kind of, I guess you can say, the enrollment in one, and then the agent sign up process. Before Steve trains on more of the product information, does anybody have any questions?
Yeah, I do. So how can I'm already enrolled. How do I add more licenses than you already have?
Sure. So you will come back to your site, and you will go into let me go here. You'll go to your agent group tree. You will hit the little blue eye button here, and you will scroll down. And right here under licenses, you will click add license, and then you can go ahead and select the state that the license is. Obviously, it's the health. If you have the license number, when your license is active, and then when it expires and goes inactive, and click and save that information.
Okay, thanks. And just real quick too on that, if this link ends up in another state I'm not licensed in, and somebody self-enrolls and I'm not licensed, am I in trouble? Or does it just kick back? Or am I going to get an email back? Or what will happen?
It won't let them enroll. So if the license is not on your backend platform in that state, and they try and enroll, it won't let them. So for example,
Okay.
also, like, if anyone tries to enroll for some reason too in a non-sale state, like California, it won't let you. It won't even bring the state up on there as well too.
Great, thanks.
Any other questions about this? I know Steve's going to cover probably a little bit more on, like I said, the ages, the types of products and stuff. So you guys might have a few more questions once he gets going here.
How do I change my email address?
What was that? How do you change your email address?
Yeah, it's not the one I want on here right now.
Sure. So same thing, you'll come into your site. You should be able to edit your information, but if for some reason you cannot edit your agent group when you're in your back end, which I think you should be able to add. Oh, maybe there's no, you might have to, I think it's Matt who asked that. Matt, you might have to email into us at quotes@America's Choice. I can drop that email into the chat, and we might just have to change your email on the back end if it's not allowing you to edit it in the agent group section.
Okay, great. Thank you.
All right, Steve, I think you're here. Do you want to go over some of the products? I can bring them up as well.
Sure. And good afternoon, everyone. Kurt, thank you for putting together some of your people. And Amanda, if we want to start with like a $500 deductible plan
Sure.
while you're
The
pulling that up.
AC,
No,
AC 500 or?
No, the
Okay.
full medical plan, full
Okay,
coverage.
sure.
So first of all, everyone, good afternoon. Again, thanks for bringing your team on board. Our job today is to give you a high-level overview of the products. I think it's very important that you write down any questions you have about the products, big or small, complex, simple, and questions you're embarrassed to ask, just write them all down. If we have time at the end, I'll definitely do an open air question and answer, but I want to get through the entire overview of the products. I think it's the most effective way. So America's Choice products are 3 HSAs, and then we have 7 metal plans. Obviously, the lowest deductible we offer is 500, and then it goes all the way up to 5,000. Those are 6 plans, and the 7th plan is a 7350. We call it a copper plan. Most of the plans are semi-identical as far as copays, etc. The top of the plan, I'm going to get some reading glasses on because unfortunately I'm operating on a cell phone. And let me see if I can widen this out a little bit. All right, perfect. So you have 2 deductibles per family, which is why you see the 500 deductible, and then per family unit is 1,000. That indicates 2 deductibles. Then you go into your co-insurance, which would be in this plan 80/20. Once a single person has reached 7350, and that is a combination of co-insurance, deductible, and or all copays, from that point on, we will be paying 100% of their bill. But regardless of which deductible you choose to offer, if you'll scroll up a little bit, Amanda, you'll see a very rich, I'm sorry, scroll down, my apologies. You'll see that there is a very rich section of copay items. And why we do this is so that, unlike a on exchange plan on healthcare.gov where you have a deductible and you have a couple of copays, everything else is deductible and co-insurance, we want our consumers visiting the doctor and staying healthy. The telemedicine has the behavioral health online, and it has dermatology, which I just used about a week ago. Well, actually 2 weeks ago. Once you get past all the copays, which, as you can see above, doctors, specialists, urgent care, etc., this section is a sampling of the wellness inside this plan, and there'll be a link attached to these plans in about another few weeks, hopefully right before open enrollment. These plans cover all 64 mandated minimum essential coverage items, and those are the immunizations, etc. These are covered with 0 copay, and the deductible does not apply. It's extensive, it's standard across the country. And again, this is part of our goal to bring wellness and access to all of our plans. When you see below this contracted physicians, this is where I want to be really careful. We are using the PHCS network. If you're in the network, if it says after copay, which means the copay is 30 or 40 or 50, after that, we pay 100% of all of the charges that the provider has agreed to accept under their PHCS network. If you're out of the network, there is no copay, and we're paying 60/40. Again, all percentages apply to coinsurance. If you'll scroll down a little bit more, in our metal plans, diagnostics, whether they're the regular lab, x-ray, etc., all apply to your deductible and then go into coinsurance. Urgent care, if you'll see right below that, does have a copay. And in the hospital or for surgery, these plans are pre-cert, which means there's no network. Based on your provider, your physician, who says, okay, Bob needs a hip replacement. We don't stick inside of a network. We go to all the available facilities near the consumer that have a high quality score, which means they are proficient at that procedure. They have a high success rate at that procedure. And we will negotiate the entire procedure. We call it the 3 Ps: the pre-care, the procedure, and the post-care. So as many of you know, when you're scheduled for a surgery, before they do it, they want you to come in for an x-ray or blood work, or, just to make sure you're healthy enough to withstand the procedure. And after the procedure, you may need to come in for therapy or to have stitches removed or other follow-up care. Our team, and we do it all day long, go out, we negotiate the entire process, the 3 Ps, with usually 3 facilities. And so once we have finished that, we will have 3 different prices. And it includes the entire procedure. We then contact your insured. Hey, Bob, this is Mary at your pre-cert team at America's Choice. We want you to know your procedure is approved, and I have a couple of options for you. You go to Baptist Hospital, the names. You go to Baptist Hospital, you meet your deductible, your coinsurance. And by the way, you've already met $1,200 of your deductible. In this plan, that means they would have met the whole thing. And so if you go to Baptist, you pay the balance of your deductible and your coinsurance. You're set to go. It's all ready. But you have 2 other choices. The other one is St. Mary's Hospital. If you choose St. Mary's for your procedure, we're willing to waive, and whatever the percentage is, 25, 35, 50% of your deductible. And then on the third hospital, which is where we negotiated the best rate, most times we'll do things like waiving 100% of the deductible or 75% of the deductible and half of their coinsurance. So this plan shares the pricing advantages that it receives with our consumers. It's very, very unique. It's an amazing experience. We see people most of the time picking the options where they can lower their out-of-pocket costs. If you'll scroll down a little bit more, we just passed maternity. We don't have to go back. In these plans, maternity is fully covered. It's after deductible and coinsurance. And you can see inside the plan, these are copay items. So for example, chiropractic, you make whatever the copay is, and you can do it 20 times per year. Speech therapy, physical. Most of you are very familiar with traditional, full-blown, full coverage major medicals, and that's what this is. If you'll go down a little more, we cover inpatient mental health and outpatient mental health. We will cover inpatient substance abuse and outpatient substance abuse. Keep going. The same thing happens here. These are all your prosthetics. And if you'll see next to prosthetics, most of the major meds now have limited them to 5,000. We kept ours at 6,500. So that's, for a prosthetic device. And on durable medical equipment, which is a pretty broad subject today, if the medical equipment they need is so expensive that it would exceed the limit of the plan, we instituted a program to rent that for them so that we could provide very expensive durable medical equipment by renting it and then each year re-renting it. So they have a really rich benefit there. Keep going. When you get to your pharmacy, this is a full-blown pharmaceutical coverage. And down below that, it'll show you exactly how it works. You have generics at 10, brand at 45, non-preferred brand, those are those expensive brands, at 85. And obviously, if you want mail order, you start to see some savings when you get to brand or non-preferred brand. You get 3 months supply for roughly 2 months cost. It's good at all the pharmacies. You can go wherever you want to go. Costco, Sam's, your grocery stores, Walgreens, Rite Aids, if there are any Rite Aids left, CVS, etc. If you notice below this, I talked about pre-cert. When your member needs something and they call us, they will share in the savings that we provide for them. If they don't call us, then they're going to be either in the PHCS network or without pre-cert, they may have a penalty. And it could go all the way up to $2,500. And I think plans that don't do the shared savings are using pre-cert for medical necessity. So this is the richest plan we offer. There are 3 age bands, etc. I'd like to jump over to our most popular plan right now, which is our AC 500. And as you see these rates for, let's say, a 45 through 54, if you look at this plan, to the rates, you're going to realize why it's so popular. These plans, there's 3 of them. This is the one that almost everyone sells. This plan's a little different than our true metal plans. This plan has 0 deductible. Coverage starts the moment you use it. There are no max out of pockets, no deductibles, no family deductibles. It goes right into gear. There are over 30 copays. The other plan has about 15. This plan has 30 copays. And you can see on your left-hand side in the bottom half, there begins a list. Doctors, specialists, therapies, even your chiropractic here are all at $50. There is a limit per person of 10 visits per year under the copay. After the copay runs out, then they will be able to access the PHCS network rates. Telemedicine, unlimited, 0 copay. And your dermatology and behavioral health are exactly the same. When we get to preventative, here again, these are the short list of listed preventative services. The full list will be available on a click. It's all 64 MEC benefits. And so a lot of people stop and say, well, what about the mammogram? Does it include the 13 different versions of mammograms for specialty issues? Whatever is covered under MEC, which is the federal mandate, is what's covered here at no charge. I'm going to stop here for a minute because we've seen allowable and you've seen plan allowable. The allowable amount or plan allowable, there's actually 3 definitions that all apply. The first definition is we will pay 100% of what the PHCS provider has agreed to accept. So there's no balance bills. The second definition is if you use some other provider that is not part of our network, we will the allowable amount, which is the average of what PHCS has already agreed to. And the third definition is it has to be allowable as a covered item. So the example I choose to use mostly is cosmetic elective surgery. No plan that I've seen covers facelifts or breast augmentations or other types of just these cosmetic plastic surgeries. However, if someone had a mastectomy, then the plastic surgery to repair the breast would be covered. So that's one example of allowable. Another example is, as most of you know, there is no medical coverage under any plan for an event that occurs during the commission of a felony. So the guy who's DUI and has an accident, most people don't think about it, but if you're in a felony DUI, your health plan does not reimburse you for the health costs that you incur. Your auto insurance does not either, by the way. They'll fix the vehicle, but they won't cover your medical. We'll go down to the bottom a little more.
On his phone.
Same in the other plan, it says, it's 100% after copay. Out of network, we're going to pay what would pay inside of PAS. And Amanda, if we keep going down, I think we can have some time for questions and answers after I give them the general background on the plan. So here, unlike the traditional metal plans, here, diagnostics, x-rays, lab, CTs, MRIs are all copaid. And I want you to pay special attention to the word per visit. This covers the tests on 3 visits. A visit may entail 1 test, 2 tests, 4 tests. When a doctor sends you to a lab for blood work, he may ask for 4 different blood tests. All the customer is responsible for at that lab visit is the $50 copay. When you're in nuclear medicine and CAT scans, which are very expensive, remember the word pre-cert, you call in. We're going to make sure you get access. And again, all you pay is a copay. So there's never been a deductible in this plan. There is no co-insurance. It's pure copays. So easy to use. Now, when you get to the ER, up top, you had an urgent care copay of $50. But if you choose to go to the hospital, or you don't really have a choice, you just go to the emergency room, maybe it's in an ambulance. Here, you get 2 sick visits and 2 accidents at the hospital ER, and you make your copay. The rest of the entire visit is covered. That's a very rich plan. It's actually amazing that it's this rich at these rates, which you'll see later. Let's keep on going, finish the plan, and then I'll explain to you about the differences. Okay. Hospitalization. We pay 2 hospitalizations per year. We pay 100% of the bill. It's pre-cert. You pay a copay. We pay the bill. So if you have heart surgery and you're in the hospital for 5, 6, 7, 8, 9, 10 days, which I don't see that anymore. It's usually 2 or 3 days. People go back home. Doesn't matter what size the bill is. The client's responsibility is their copay. Same thing for intensive care and the same thing for surgeries. Room and board for maternity. This plan is the best maternity plan I think anywhere I've seen. If you have a normal delivery, it's a $250 copay. And if the birth requires C-section, the copay changes to $500. If you'll notice on the left side under room and board maternity, it says dependent daughter pregnancy is not covered. Maternity is only covered for either the covered adult or their spouse. It's important that we understand why I said covered adult or spouse. A man and a woman, assuming that's the relationship, typically people say, oh, my wife's having a baby. Well, people don't know that if the husband, the male, has a child outside of that marriage, the maternity would not be covered, but that child is eligible for coverage under his plan. That is his child. And that is why in the medical questions we ask, is anyone applying for coverage expecting a child? So what would happen, and this is what we wanted to cover this for, is got a married couple, male and a female. The male has a child outside of the marriage, and the baby is born into NICU. Once that child is in NICU, that spouse could add that child to this plan within 30 days, and we would be stuck with the NICU charges. So we ask a qualifying question up front. Is anyone expecting a child? We don't say, is anyone pregnant? So you can see here, even the inpatient hospital mental health is a copay, but it's limited to 10 days in the hospital per year, 2 times. Now we get into the cancer. People say, what about chemo, radiation? It's $100 copay per administration. And if we can go down a little further, Amanda, substance abuse, keep going. All of the things we looked at up top are clearly defined here. There's a couple of limitations. Hospice is limited in this plan. In our full metal plans, it is not limited. Here it's limited to $5,000 of hospice care, which is usually good for about 2 weeks. Again, the prosthetics, the durable medical equipment, they have some limitations, but they're all copays. And in this plan, the pharmacy is different. Your generic drugs, whether they're for acute, like someone needs it right now, your doctor says, go to the pharmacy and get an antibiotic, or go to the pharmacy and get your medication. That's also a zero copay. And for the maintenance meds, which we send to their home, 90-day supplies, are also zero. The brands and specialty are available through the program, but it's through PIP, PAP, and foundational. These are assistance programs to access drugs. This plan, if you'll go down to the very bottom where the rates are, this plan for an entire family is $929. Yes, it does have some limits. And let me start at the top. You don't have to move the page, Amanda. This plan, the one we're looking at, is the 500 AC. That means that every person that is covered has $500,000 limitation on their coverage per year. So you have 5 people in the family. Each person has their own $500,000 limit. And over their lifetime of being covered, it's 5 times the annual limit. And if you look up top, it would say 500,000, 2.5 million. This plan is designed specifically for what we call the working middle class American family who makes too much money to qualify for the subsidized ACA, but not enough money to spend $1,500, $1,700, $1,800 for their family. This plan has taken over the marketplace at a very high level. But if your client can get into one of our metal plans, there are no limits on coverage. There's no lifetime limits. And obviously the rates are a little higher. They do have some co-insurance and deductible issues. But I want to make sure we're all very clear. There are 11 questions to qualify. I think you saw them in the training. So it kind of is, I know it's repetitive, but if you're selling someone insurance and they make 45, 50,000 household income, the ACA is going to be free, if not almost free. I think that's the place to go. No different than if they're a veteran and they don't understand their benefits, they may get free insurance in the VA. If they're under $18,000 a year, I believe is the number last year. I don't know what it is this year. They get Medicaid. That's absolutely free. And it's it is what it is. And obviously, if they're over 65, you're going to move them to Medicare. But for those people who are just reasonably healthy and have to pay for their own insurance, our options are coming in at a phenomenal price point. So now, how much time do we have left? Let's see. Anybody got a timer on?
Got about 6 minutes, Steve.
So these plans are covered under Granular Insurance Company. The people, and Granular's A- rated. They were bought by the parent company of Google, which is a company called Alphabet. We have combined the other set of benefits, which is the personal health dashboard. Personal health dashboard is an extremely extensive set of features. In there, you have your health coaches, your fitness coaching, weight loss, smoking cessation. Sorry. You have your holistic medicine doctors. You have weight loss exercise programs. You can connect your health plan to your wearable device. A lot of people think of Fitbit. You know, they count their steps, they watch their diet. There is an extensive wellness program in here. The applications are easy. And the last thing that people usually ask about is, what are the ages? So you can enroll someone the day they turn 18 until they turn 63, which means it's 18 through 62. But a 62-year-old, a day before his birthday, if his effective date falls in the year that he is still 62, he or she can enroll. Once they're enrolled, dependents can stay on the coverage till they're 26, and adults can stay on until they qualify for Medicare. So 18 through 62, coverage through 65. Our rate bands are for the first year. After that, there's no more age banding. What happens is if someone's in the middle of an age band, the following year when they get their renewal rates, that will be their rate. So there's no big jumps when people have age ups. And the primary self-employed applicant is the age that you use to rate the couple, the family, or the single parent with children. I know that doesn't leave us a lot of time for questions, and I hope you've written down every single question you have, but let's open it up. And Kurt, do you want to take charge for a moment? I think you're on mute, sir.
Oh, sorry about that. Okay, thanks, Steve. Thanks for being on. Amanda, thank you. Just a question, couple questions. The first one, for someone self-employed, to what extent, and we have a lot of questions about that.
Sure.
You know, someone self-employed, can they do it part-time? It has to be full-time self-employed. That's the first question.
Perfect. So self-employed means you have some form of independent income that is not W-2. So I'll give you a couple examples. I hope it kind of describes it, but if not, we'll go through it again. I'm a day trader. I trade stocks. Well, you know, you may or may not make money doing it, but you're self-employed. You work during the week, and on the weekends, you do anything from helping people with web designs, mowing lawns, definitely self-employed. You don't work anywhere, but during the year, there's some things you do to earn money. You're self-employed. You're a hairdresser, attorney, you're a doctor, you're a plumber, you're a carpenter. You work for yourself, you're self-employed. None of these things require you to have a corporation, an S Corp, an LLC. Sole proprietor means that at some point you have made money that you put on your tax return outside of a traditional employer.
Great. And if you don't mind, can you just go over the, someone signs up, they have to join the LLC?
Yep. When
Thank
a
you.
member joins this plan, they are joining a huge group. They are signing in their contract, which you guys see, that yes, I'm applying for coverage. They are joining Population Science Management's large group plan. They become a bona fide partner and a working owner. At the end of the year, they will receive a K1, and the K1 will be whatever the distribution of profit that the company shows, and the 6 or 8 or 9 things that throughout the year they complete. To participate in the plan, there's a working owner brochure. I'm glad you brought it up, Kurt. And they have to answer questions or do a survey on different items throughout the year. They're super simple. We haven't had anybody fail to do them. And one of them might be they went to the doctor, they'll get an email. Please answer the questions about your doctor visit, etc. Another one might be if they're on a medication, they'll be contacted. You know, there's a couple ways they do it. It's super smooth. This methodology of communicating with these working owner members of the plan There's 180,000 people on the PhD. And so it'll be, have you had any reactions to your medication, et cetera, et cetera. Then there might be a general health questionnaire. Help us learn more about your health. Has nothing to do with qualifying for the plan. It's just us building a health database, and population science management manages that data, sells they don't sell anyone's data. They sell the aggregated data, which is why we get the insurance carriers to give us specialized rates and allow us to give these kinds of coverages. Any other questions on that, Kurt? Did you want to dive into any other area?
No, I think that's all I have. Anyone else have any other questions? I see Dave asked a question. Dave, I'm sorry, what's the question again? I didn't see that. It came up.
I saw the word Medicare.
So there's two questions, Steve. One of them is there any social media sales materials? And David, we have various sales materials that we can distribute to Kurt, and you can get them out. Specifically, there at this time there are no like videos or TikToks or anything like that that has been developed. They're probably looking to kick off some of that maybe in 2024, but for right now, no videos per se, but just some regular sales materials that we can for sure get out to you. And then secondly, the second question, Steve, is if the business owner is already on Medicare, can the underage wife apply?
Absolutely. Providing she has some way that she actually earns money. So a non-working person who does not have any form of self-employment. I mean, Uber drivers, fine. Bake sales, providing their own income is fine. But a non-working person who has no income that's one of the eligibilities. And the reason for that is the underwriters understand that people who are self-employed have things they have to do. They're not running around trying to find reasons to go to the doctor. And the utilization on healthcare for self-employed is much different than those who have no employment whatsoever. Also, just as a note, people on federal government or state government or municipality plans use healthcare almost 2 times as much as your average person. Just thought that would be a fun fact. There was another question.
Yes, there's a couple more. Rate increases. Does an individual's loss ratio for an individual plan negatively affect their increase every year?
No. So that's a really great question. Whoever asked that, big thumbs up to whoever it was. Everyone is in one group. We bring healthy people into the group. We have an amazing health management system. For 5 years in a row, our rate increase, the average rate increase over the last 5 years was 2.7%. When you join this plan, let's say you join in October, your rates will run through September 2024. And when you renew next October 1st or November, whatever, you will get the same rate that was published in July for the entire group. So you'll see the rates. When the selling rate changes, you'll know what your renewal rates for your clients will be, because we only change our selling rates once a year. And your deductibles run your individual insured, the member of the plan, their deductible works on their 12 months of coverage, as does their rate. Hope that answered that question. Follow-ups are welcome.
Okay, a couple others, Steve. Hopefully we can sneak these in. Even someone selling on eBay, would they qualify as self-employed?
100%. Like, that's an easy one.
Okay. And can you touch on just some brief overviews of how the HSA plans maybe differ in copays or allowables to the tradition or to the other metal plans?
Sure. So we don't sponsor the HSA bank. Our HSA plan is a qualified HSA plan. There are no copays of any types. You have a deductible and coinsurance, and you just go to any bank. I know Bank of America is where I keep my HSA. When I had an HSA up till last year, and now it's just sitting there. I had to go to our metal plan so I could really run our own plans through the grinder. So I personally own these plans, and in 37 years as a licensed agent, I was on Blue Cross and Blue Shield of Florida, and I sold major medical for everyone. This is the only plan I've ever sold that I would own. That's kind of sad, but I'm really proud of it. So your HSA is an account. You can manage it in any HSA available banking facility across the country. But our HSA plans for benefits, deductible coinsurance, 100%, and you're all set to go. And for those of you who sell HSAs, I think you'll recognize that for someone who is smarter financially, more organized financially, the HSA is the best option in the country, because over a 10-year period, you will always come out ahead in an HSA.
Okay. I think that was the last question. Does anyone have any last minute ones they'd like to ask?
Wow, Kurt. Don't be surprised if you get a list of emails from all your people with another 10 questions. Want those questions. We need you to feel comfortable. And what I'll end with on my end, and Amanda, you may have some things to wrap up, is this is not only a plan I bought, my brother's covered under this plan, a number of my neighbors and a lot of my friends who are, like my own personal attorneys, 30 plus years family attorney for me. He's on this plan. There's quite a few physicians actually buying coverage for themselves. There's not a lot of independent physicians anymore, but there's a lot of independent medical people who contract themselves out. These are really solid, and I think you're going to be extremely proud. And if you do sell it to someone before they turn 63, in 2 years, when they qualify for Medicare and they were on this plan, they're definitely calling you saying, wow, you gave me a great plan. Can you help me with Medicare? So this is a great place to park the underage spouses. And it's a great place to park anyone who is not getting a subsidized ACA option. But if someone is too sick to answer the questions with no, it doesn't matter what they have to pay. They have to go to the ACA because there's no pre-X, et cetera. We have no pre-X. We have no waiting periods. We just will not accept someone who is currently under those types of treatments. Did you cover the medical questions pretty well, Amanda?
We reviewed them. I think that everyone needs a copy of them for sure, though.
So I'm going to pick on the two questions where I get like, well, what does that mean? So one question says, have you had a surgery in the last 5 years and are still under treatment? Well, let's say you had a hip surgery and you are going in for hip therapy. If you're still in therapy, we won't cover you. If you finished your therapy, then the question says, have you had a surgery in the last 5 years that you're still being treated for? You would say no, and you would get covered. It doesn't ask about things that are 6 years, 10 years, 15 years ago. And it's kind of funny. I laugh when I get a call from an agent or we see something pop up and they say, I'm speaking to my client. They had a surgery 7 years ago. It's like I just freeze. And I'm like, when they're done talking, I say, 5 years is the question. That's it. And the hospital question's the same. Have you been in the hospital in the last 5 years for something that you are still being treated for? So I think the questions are designed. I think the actuarial number was to accept 91% of applicants. Obviously, that doesn't include someone that you already know. Oh, I've got a client. They're undergoing cancer treatment. Let me see if they qualify. But normal people that you interview, about 90% of them will be able to answer these questions and get covered. And I don't think I need to repeat if they're able to get a full subsidy. Well, I think that's the place to put them. Kurt, your organization's amazing. I know that your agents are going to make a ton of money with us, and we're going to be able to work for your team and all the people on this training and your future trainings. Please send in any follow-up questions. I don't want to hold anybody. Thank you for all of your time. Amanda, is there anything else to cover it up?
No, we will let me just stop the recording and we will make sure that this recording comes over